Very good evening to everyone online and assalamu alaikum. Today I'll be talking on COVID-19, healthcare workers' safety and health, and I'll be sharing with you the Malaysian experience. So my presentation outline, I will just give you a brief where are we today in the pandemic, our containment strategy, and also on healthcare worker safety and health, some of the guidelines, the pre-exposure management, post-exposure management, and the new norms. As of December, as of 2 December this morning, early morning, 2 a.m., this is taken from the WHO dashboard. The confirmed cases has hit more than 62.8 million people, which about 0.1% is in Malaysia. Malaysia has 67,000, more than 67,000 cases. Death globally is about 1.46 million, and Malaysia had 363 deaths. That is about 0.025%. So if you see, this is the pattern. If you see the pattern in Malaysia, we had the first wave, which was not many cases, mainly imported cases, and then came the second wave. But now we are being hit by a quite bad third wave, and you can see the spikes in cases. And for the last 1 to 2 weeks, we have been having 4-digit, more than 1,000 cases in a day. And we have also imposed movement control order, started from 18th of March. Various kind of movement control order is either a full movement control order or a conditional movement control order, and so forth. So at different stages of the year, of the 10 months, we have started this 4 or 5 different kind of stages for the movement control order. But if you look at the overall public health preparedness and response, there's about 16 here, but this one is only talking about the public health side, but there are also a response from other ministries and other interagencies. And a lot of it is in terms of active case detection and contact tracing, strategic communication, lab and hospital capacity, maintaining infection prevention control protocols and PPE is very important. And we need to protect the healthcare worker safety and health. And today, a lot of my focus is going to be on healthcare worker safety and health. And of course, all other response includes international collaboration and utilization of digital health and technologies. So this is taken from Statista, where there has been a lot of reported health workers that have died from COVID-19, and Mexico being the highest number, followed by the United States and also UK. But in the local scenes, taken from our print media, we have had cases since February, and the cases are also, there is daily cases. And I think today we have for the Ministry of Health, healthcare workers, I think there's gone more than 1,300 cases, and mainly 30%, about 30 to 32% is community acquired, and there's also healthcare worker to healthcare worker transmission, and also a very small number which is patient related. So this has caused a lot of disruption in the hospital operations, and some of the hospitals requires part of the hospital to be shut down. We have come up from the beginning to today, we have come out on version 5 of our COVID-19 management guideline, and the recent update was done on the 30th of November. And one of the Annex 21 is the entire Annex where it is on management of healthcare workers during COVID-19, and it was just updated a month ago on the 2nd November. We also have a SOP for COVID-19 sampling procedures of healthcare workers. So if you look into our strategy in protecting our health workforce has been our priority. So we have a pre-exposure strategy, post-exposure, and also communication. So some of the strategies I will be further elaborating. But if you notice, communication, I think, is very important. We need to give regular updates to our healthcare workers in terms of guidelines, information, infographics. Psychosocial support is important, fake news management, and also press statements, especially when it's affecting operations of a hospital. In terms of pre-exposure and post-exposure, I will be further elaborating. So in terms of exposure risk to COVID-19, we have three level of exposure. The first one being the high risk exposure, and number two is the medium risk, and three is the low risk exposure. So depending on the exposure risk assessment, and exposed healthcare workers will be categorized according to high risk, medium risk, and low risk. And based on that, this is from the Annex 21, which I've mentioned earlier, we have what are the steps to be taken in terms of risk assessment and management with exposure. In terms of whether the healthcare worker is wearing mask, or the patient or the person who's exposed is wearing mask, and so forth. So it's quite a detailed management guideline, and also talks about asymptomatic and symptomatic healthcare workers. But I'm not going to go through this, but it shows that there are guidelines to be followed. But we also have healthcare workers with specific needs, especially in high risk, those who have chronic diseases or pre-existing illness, pregnant healthcare workers, and immunocompromised. So their work and their schedule and the work task is rescheduled and reorganized to different areas to avoid exposure. We came out with the OS management guideline in terms of a summarized version, where strategic communication is on the top here. I've mentioned earlier, it's very important to give right information, SOPs, and reassurance. Reassurance is very important for healthcare workers. And in terms of pre-exposure, these are some of the guidelines, and also post-exposure. In terms of post-exposure, we are not only talking about healthcare workers, we must also talk about the service, the continuity of service, prioritization of the emergency service, and what about relocation? You know, if some of the parts of the hospital is closed down, can we relocate to another hospital? Psychological support, data management, and also the COVID-19 samples are very important, where prioritization needs to be given to healthcare workers and with a fast turnaround time. So what are the pre-exposure management that we have started even way before? As usual, like any other, is health screening and temperature checking for healthcare workers at the start or a shift of a work is given a priority. This is a picture in one of our hospitals. We also have an healthcare worker declaration form, where they have to declare at that time if they came from high risk areas, or they had an exposure to a COVID positive patient, or if they have symptoms like fever, cough, and so forth. So this declaration is in place. At the same time, actually, we also have a declaration by the patient when they come to see us. These are some of the education and information and training that is given to our healthcare workers. So if you notice, there are some trainings that's given, and also how to wear proper PPE and so forth. So this is continuous. It's very important to give training, information, and so forth to our healthcare workers. We also came out with guidelines in terms of use of PPE, where each of the areas that we have come up with what are the activities and the type of PPEs to be used. For example, in emergency, in inpatient setting, in areas in clinic, and so forth. So it is quite a detailed guideline. And the choice of PPE is based on the place of work, the patient status, a patient that's in front of the healthcare workers, whether they're suspected, they're COVID or non-COVID, and exposure risk, and also method of transmission. So this user guideline can be is downloaded from our Patient Safety Council website and also other websites. At the same time, we also ensure that whatever PPE that is being used or a respirator being used, they are given training, and also a fit testing is always done by the OSH team and also the infection and prevention control team of Ministry of Health. So these are some of the scene that you see in our hospitals. So this is to ensure that this is the respirators are best fit for the healthcare workers. What about post-exposure management? For healthcare workers that is confirmed with COVID-19, our reporting system requires three reporting. One is the communicable diseases notification form. This is for all cases, including patient and also healthcare workers. And then we have the WEHU form, which is the for occupational disease, occupational conditions. And also we have the investigation form of healthcare worker with COVID-19, where a detailed investigation is done of the exposure and from where they got it. So these are all in the guidelines management. We also use isolation cabin for swabbing the staff and also the patient. So if you see, this is our hospital tower, and this is our National Cancer Institute, where the patients or the staff sampling is done. And contact tracing is also done within the hospitals for healthcare workers that is exposed within their department, their units, or we also track all their movements in the hospital. So what we have done also based on this experience, we have cut down staff moving from one floor to the other floor, and we try to limit the movement. Priority is given for the blood test, for the sampling done for staff. So if you notice, it has to be done in a fast turnaround. They have to be given a priority, and there is a sign written as urgent. So healthcare worker samples are given a priority. We also have a strict SOP on return to work. And so healthcare workers is allowed to return to work, and there are strict SOPs in terms of where the occupational safety and health is notified. There is a staff declaration form, and the strict wearing of surgical masks is very important. And it must be worn at all time while in the healthcare facility. But there are also PPEs that's used based on where they work. And all the other hand hygiene, respiratory hygiene, and so forth. We try to restrict the movement and also continue self-isolation at home upon returning from work. Our 3C and 3W avoid confined area, congested, and so forth, and also adhere to all the SOPs. Has always been strictly advised to all the healthcare workers. So they must avoid confined areas like the pantry, the on-call room, or prayer room. We realize a lot of the infection happens when they get together outside their during their rest hours. And we also restrict of the healthcare workers who have returned to work to be in the immunocompromised patient areas until the 14 days is over from the exposure. We have strictly daily monitoring. This is done by the occupational safety and health officers or an authorized personnel. And also, if there is any onset of new symptoms or even mild, we immediately stop all patient care activities and notify the OSH supervisor where the subsequent action is taken. If you see this, what about psychosocial support? If you see the numbers here from March to 16 November, we have more than 175,000 number of healthcare workers have been screened, and some have acute stress disorders, severe anxiety symptoms, panic attacks, and severe depressive symptoms. And out of that, about more than 1,000 have been referred to psychology officers or counselors, and about 600 has been referred to specialists, to see them. So there's a lot of psychosocial intervention has been done for healthcare workers, either a psychological first aid, a psycho education, art therapy, and also relaxation techniques. So these are some of the psychosocial interventions that's been given to healthcare workers. So giving a psychosocial support is very important for our healthcare workers. And we also have mental health and psychosocial support services. This is run by the counselors, psychiatrists, we have clinical psychologists, public health specialists, family medicine specialists, and also NGOs, and also the medical social workers. So there we have this team at the HQ level, at the state level, and also at the district level. So some of the activities that's done by this mental health psychological service unit is we also give activities to the healthcare workers responders, where we do in preventive, we do pre-deployment briefing, we distribute the psycho education materials. We'll make sure there are someone observing the healthcare workers to avoid burnout. There's also a regular mental health self-check, and also QR code is also available for psychological first aid, post-deployment debriefing, and mental health alert card. So these are some of the healthcare workers who are getting the briefing for preventive. But what about reactive? Reactive after they have been exposed, there is face-to-face individual consultations or group consultations, teleconsultations. We also do give grief counseling for families of healthcare workers who have died due to the COVID-19, which is quite a small number who have died. And we have expression box in COVID-19 wards and screening centers. So if you see, a lot of focus is given for mental health of the healthcare workers. But moving forward, what is the norms? What are the new norms? What is the new behavior? All of us as healthcare workers, as healthcare professionals, and those who are working in hospitals or clinics or healthcare setup must adhere to. So some of the new norms and the new behavior, of course, one will be the safe social and physical distancing, sanitation, pre and post operations, compliance to SOP is very important. When we are talking about compliance to SOP, it must be at all areas. It's not only when we are meeting patients, must be in the cafeteria, ward, pantries, prayer rooms, on-call rooms, and meeting rooms, and even the toilet. This is very important in practice of physical distancing. We encourage virtual meetings and events for healthcare workers. And also, I think with COVID, we have realized that occupational safety and health plays a huge role in this pandemic response. So strengthening the role of OSH unit is very important in the facilities, and everyone must play their part in supervising the healthcare workers. Other than that, hand hygiene, practicing the 5 moments of hand hygiene, doing it correctly before touching the patient and after touching the patient and the surrounding is very important for our healthcare workers. There's also new recommendation for frequency of cleaning of the environmental surface, of the ambulance, and so forth. And so this cleaning and disinfection is important. We have also had infection of our healthcare, our support service in the hospitals. So this is not only for our healthcare workers, but also for everyone who is working in the hospitals or clinic. There are new norms compliance audit that is being done, and this is two hospitals that we see the compliance audit being done, and this is the audit report to ensure that our healthcare workers follow the SOP. And very importantly, strategic communications. We have info blasts, a blast through the social media. We have posters and infographics, and also a lot of SOPs and flyers that is done to communicate to our healthcare workers. Information dissemination is very important. If you see, we have had multiple stakeholders in managing healthcare COVID-19. So we have had presentations via video conferencing or meeting of public and private sector, where all this is given regarding managing healthcare workers during the pandemic. So if you see some of the pictures here, this is done as a workshop, and there's also engagement with the NGOs, and also done by the university hospitals, and also via video conferencing. So finally, as I end my talk today, I think our tribute to our healthcare workers it pours in a lot, and it's very important. They have worked very hard in managing this pandemic. So these are some of the tributes that's been done for them. We have had the World Patient Safety Day this year, and then we had the World International Labour Organization also had some tributes. We had Doctors' Day, Nurses' Day, and so for International Pathology Day, not forgetting lab personnel play an important role in this pandemic. And then we also had our Independence Day, where the healthcare workers had a tribute, and we even had a book like a coffee table book that has the chronicles of our COVID-19. And if you see, there's a lot of tribute by cartoonists, by graphic designers, even by McDonald's, who has given a big thank you to all our healthcare workers. It's not only in Malaysia, there's also all parts of the world where the healthcare workers are given tribute. So this is some of the examples. So with that, thank you very much. And I hope I've given you some background and sharing some of our experience in Malaysia in managing the healthcare workers. So I get back to you, Azurin.
Thank you, Dr. Fazila. So I would like to invite Dr. Min Sambat to share his experience.
Thank you for introduction, Suren, and thank you, Dr. Fazila, for your great presentation about the COVID-19. So I would like to share about the Cambodia, and Cambodia we have about 16 million, and we have 20 provinces, and we have a border with Thailand, Laos, and Vietnam that have the reactor here. So so far Cambodia saw the good response to the COVID-19 pandemic, and we have received like number 3 in the world and number 1 in Asia, that evaluated by the one agency in Africa just released the new. And so far we have confirmed case that 329, and we have a recovery like 305, so about 92%, and only 25 patients still in treatment, about 77%. And this calculated by the daily case confirmed like 20 per million population. So we have no death case, so that good for Cambodia. and more recovery like about the 92. And the government set up the good system that we have the National Response Committee that chaired by the Prime Minister and secretariat by the Minister of Health. So we have a response to the COVID. And we also have the guideline for the treatment COVID that developed joined by the WHO. And so far, we don't have the health worker that infect or exposed or affected by the COVID-19. And we have the team from the government like doctor that from the government officer, and also the voluntary medical doctor that prepare for in case that we have emergency or more case in Cambodia. So right now we have a small case, so not much like other country. So we have a still good response. But recently we have some issue with the community transmission that we have the infected from people at local level that not travel to abroad. So we still have precaution and among 2 weeks to be ensure that no more case from this community transmission. So I have 1 or 2 questions to Dr. Fasila. So in Malaysia, do you have any health worker that are infected COVID due to the work or no? And you talk about the precaution for the health worker. How about the measurement or any precaution for the patient who are in hospitalized or in healthcare? Thank you.
Sorry, sorry, somebody. Your first question is
Do you have any health worker that infected or affected from the COVID
oh,
in the work? No?
so you mean while managing a COVID patient?
Yeah.
So far, we don't have while managing the COVID patient. So it all happens either in outside the COVID ward, either in the when they move around to the pantries or meeting room or prayer room and on call rooms and so forth. So that is why we always say the COVID ward is the safest place because that's where they are fully covered. So far we do not have. But I'm very interested to know that you just mentioned Cambodia does not have any healthcare workers infected.
Yeah, no.
Oh, so you mean they are really fully of course your PPE is enough and so forth. Am I right?
Yeah.
Oh, okay, that's very
And we have the team like we have the team that when they do the treatment COVID, they stay in the hospital for 15 days. No, come home after the work. They go to the hotel for the quarantine 15 days.
okay. So that means your healthcare workers when they finish
We
their
have 3 teams. Yeah,
oh, I see.
3
So
team
they go and
rotation.
stay in a hotel for 15
Yeah,
days before they go home.
yeah.
Right? Oh, okay. That's very interesting. We had that also when we have healthcare workers that we do under investigation or under surveillance, where when we fear there is an exposure, we have quarantine center. Or in the earlier phase, we had hotels where they don't go home or mix with the family, or we have our hostels and so forth. So I think that is a very good step that Cambodia is taking. I also understand you have a national response committee. We too have a National Security Council, which is chaired by the Prime Minister, where we have many agencies in there, ministries in there. So that's how we manage the coordination at the country level. But at the Ministry of Health level, we have our crisis center, CPRC. But in terms of management of patient, it's the same as everywhere else. We admit all positive patients for a certain period. Of course, 14 days is the maximum, and when we do second sampling before we let them go. Yeah.
Okay, thank you. That's all from me.
Thank you, Dr. Sambat. Next, I would like to invite Dr. Wing Min Han to share his experience.
Thank you, Azri, and also very much. Thank you very much to Dr. Fasila for the fantastic talk. So a little bit disclaimer for what I'm going to react. So it will not represent any government institutions or any organization that I'm affiliated with. It's just only my personal observations and some of the news from my peers and colleagues working in the Myanmar at the moment. So everyone knows that Myanmar is currently facing a bit struggle with the COVID at the moment. We got nearly 100K cases in total, and also nearly 2,000 deaths so far. So it's very a big challenge for the healthcare workers and also for the government and management issue as well. So the main challenge is still going with the testing capacity and health infrastructure, and also some of the economic burden and domestic stability. So if we look back into 2018, the data from the World Bank survey was showed that 6.7 physician per 10K population. That was much lower than to the 15.6 per 10K population in global average rate. So the ICUs and also ventilators were very insufficient at the beginning of the pandemic, but with the donations and the fundings from the different institutions, also different funding sources, the government has been trying to search the capacity by constructing the makeshift hospitals, quarantine centers, and so also some of the clinics, and trying to procure ventilators and also some of the funding for the ICU units. But these, of course, are kind of compromised by the lack of the medical staff because of the and very undermined human resource for the medical workers. Not just only the physicians, but also different other staff as well. So the government has called upon the volunteers to help at the state quarantine centers, but because of the mandatory 14-day quarantine and also increasing enormous caseloads that have been stressed of all the volunteers and healthcare workers. So there's some burnout and also some exhaustion for the healthcare workers. So it's very interesting from the to hear from Dr. Faisal talk about the psychosocial support. So it's very important because it's not just only embraces the healthcare workers' safety, it's also motivate them and try to work at the front line and trying to communicate day to day cases with the patients and also the seniors and also the management team. So I guess that's a very important part that we would like to hear more about that. And also the communication aspect of the COVID situation is also need to be strengthened, I think, in my opinion. So for the healthcare worker safety and for the hospital safety in general, there's also some of the guidelines that have been provided from the Ministry of Health, but intensive training and also some of things have been very impacted because of the current surge and the workload by the different hospitals and different centers. So I guess it might take a while for these things to get a little bit stable because of the past few weeks that have been a big election and big rallies going on. So there's some expectations about some surges in the cases in a couple weeks. Probably it could be settled down a bit, but hopefully we will see in the coming weeks. And lastly, the vaccinations, the State Council have announced that the vaccination will be prioritized for healthcare worker at the very beginning, and then as long as they have secured some of the million doses for the first batch of the for Myanmar populations. With that, I'd like to thank all of my colleagues and also the other frontline healthcare workers and volunteers for their contribution in the fight of this COVID pandemic. Thank you. Thank you.
Thank you, Win Min Han. When I hear you, it's the same thing that we went through, and we are still going through. But our biggest challenge is right now in the third wave, with a lot of spike. And a lot of the clusters, of course, one of it was due to post-election. We also had an election, a statewide election, and then now we are having issues about foreign workers because of their living condition and so forth. We have clusters of foreign workers. Initially, we also had clusters of illegal immigrants in the detention centers. And like you, earlier we had issues in testing capacity, PPEs, supply, lab supplies, even in ICU about ventilators and so forth. We had a lot of donations. We also had emergency procurement done. Well, healthcare worker shortage, I think is quite, it's not only in this part. I think many parts of the world is having this issue, and also mobilizing them from a green area to help in the red zone and so forth. So right now we are doing a lot of mobilization. We are hiring healthcare personnel on contracts, those retired nurses and so forth to come back and help us. We have a lot of support from the private sector in helping us in this emergency. It's very interesting you're talking about makeshift hospital. We also have makeshift hospitals done by the army, and we also had where we did our one of the convention center was changed into a low-risk treatment center. So we have a quarantine station, and we also have a low-risk treatment center. So right now, most of the category 1 and 2, we are keeping in the low-risk treatment center, whereas category 3 to 5, we are admitting them to hospital. Yes, bed capacity, ICU bed is also a huge challenge to everyone. So basically, I think we all of us have a similar story, and yeah, and we are all in the same journey. So hopefully, we all recover from this very soon and bring back the economy to life and revitalize the economy. To you, Greg.
Yes, hopefully. Thank you. Thank you to the.
Next.
Thank you, Dr. Wing Min Han. Next, we would like to invite Dr. Teputan Sapan. So Sapan to share his experience.
Thank you, Azurin.
Azurin is not well, I think.
Thank you, Fasila, for your good experience. Based on your presentation, I think that the infection and prevention control is really important for reducing the speed of infection to patient and also the healthcare worker who are particularly exposed to COVID. PPE and also the essential commodities are required. I would like to say experience in Laos. Presently, Laos PDR has only 39 laboratory confirmed positive cases. Around 2,000 suspect case tests. And if we compare with the other country, is reasonable. And no healthcare worker infected with the COVID-19. It is a good opportunity for us, for Laos PDR. For the IPC, is the one of eight component supports preparedness and emergency response to the COVID. It is implementing by the on hospital in all level by the provide PPE and other equip needs to on healthcare staff. We have opportunity to upgrade healthcare service by support from government and all the developing partners to upgrade healthcare infrastructure by build the isolated rooms in central and provincial hospital. And the laboratory capacity also strengthening part of the COVID response. It is conduct testing with the support from laboratory specialists from the WHO and a strong collaboration with the partner. But however, in Lao PDR, we have the challenge in the sub-national level is still challenges because we for the health services and also human capacity skill for the infection control. And in Lao, we lack of the psychologists. So I would like to ask you about the in Malaysia, do you have any support to the healthcare worker family who are exposed to the COVID-19? Yes, thank you.
Yes, there is support to the family, especially those healthcare workers who died in the COVID-19. There's a lot of support and grief support for the family. But other ways we support the family, protecting the family is by protecting the healthcare workers. So we tried, like I mentioned earlier, if we suspect there's some exposure, we try, in the earlier phase, we had places for them to stay so that they don't have fear of going home and infecting their family. So indirectly, we are actually supporting the family together with the healthcare workers. So this is some of the things that we are doing. But there's a lot of tele services, virtual services that being offered during this period, not only for healthcare workers but also for family and also for the patients. And a lot of community empowerment program also has been started. So I think we have to give support at all levels to the whole society in managing this COVID. And I'm also very surprised that Laos does not have the healthcare workers that's infected. What are you doing differently and how are you protecting? Is it same as Cambodia? You don't allow them to go home until 15 days is over after work?
No, and for the healthcare worker who take care in the for the COVID patient, they have to quarantine for 14 days and before leave them to go home.
I see. Okay, so you
the same gesture. Yeah.
Same as Cambodia just now. Yeah?
Yes.
Okay.
Yeah.
Interesting. I also have on this call the head of Dr. Azli Hanis is also on this call, who's the head of OSH unit in the headquarters for the hospital facilities. So well, she can also chip in to answer if there's any questions. Next.
Thank you.
Thank you, Dr. Tem. Last, let's hear from Dr. Pongtandat about his experience.
Hello everyone. I'm Pongtandat from Vietnam. Now I will share experience by Vietnam about protecting the health worker, health workers in Vietnam. You see, we have a case in the Bạch Mai hospital, one of the biggest hospital in Vietnam, when many doctors infected by COVID from the patient and from the and from the person outside the hospital, so that after this situation from the Bạch Mai Hospital, the Minister of Health of Vietnam develop a guideline to protect the doctor and health workers in the hospitals. The first on the hospital doctor and health workers and have the protected shoes and the face mask during working in the hospitals. The second, we have a guideline to route separating in the hospital when we require on the patient in the when treatment in the hospital must be checking two rounds. The first round we check the we check by the camera, the hit camera, and checking, and after that we check we require the patient to register the name and the health status before we decide they come with they come as a normal patient or else they have to go to another route in the hospitals. And we have we also develop the cabin for the hospital doctors when check the patient may be infected by COVID. In Vietnam, we have at least 2 cases infected in the hospitals. The first case in my hospitals in Hanoi. The second case in the hospital in the Da Nang city. So that now we have we developed all the guideline for protect the hospital work the hospital doctors. Now even the COVID in Vietnam is under control, but we also require that all the people go to the hospital must be protected by the face mask and the protective shoes, and all the hospital, almost the hospital, have a camera for checking the temperature of the people when come to the come into the hospitals. Is our case. Yeah.
Okay. So yeah, it's the same SOPs that we also have in all our hospitals and even at business premises and so forth. Temperature checking, PPE, and everything. Yeah.
Yes, but we have a health registration form.
Yes.
When the hospital you have register and declare the health status before coming to the hospitals.
Yeah. It's a declaration form. Thank you.
Yes.
Thank you.
Okay, thank you to all our reactors for sharing their country experience. Now we open for Q&A session. Please feel free to type your question in the chat box. Okay, Dr. Fazila, our first question is, what is Malaysia prioritization for COVID-19 vaccine? How high in the list?
Okay. I'm not sure of the we have a vaccine program, a vaccine roadmap for COVID-19, but I'm not in the team, so I'm not sure. But healthcare workers, I'm very sure that it will be given prioritization, and also the vulnerable groups. But the details I wouldn't know. I'm not involved in that. But I know there's a national task force that's already been set up, and it is also agencies and interministerials who was involved in this entire vaccine procurement and so forth.
Okay, thank you. So the next question is, what is the best practice to improve OSH in the hospital?
Well, I think the best practice is follow all the guidelines that has been given. But it's very interesting to see what's happening in Cambodia and Laos. If to have a zero healthcare workers that's infected, and their healthcare workers actually do not go home after their work until the 14 days is over. It's very interesting. Perhaps that could be done because the cases are low. So I'm not sure how much we can practice that in other parts of the country, other parts of the world. But definitely, I think adhering to the SOP and the new norm and the new behavior is very important in moving forward.
Okay, thank you. Okay, our third question from the attendees is does Malaysia also suffer from healthcare worker migrating to other countries? How is MOH managing this?
Who asked this question? This is not COVID-related question. I'm not going to answer.
Okay,
So
so
of course, like many other countries, we have healthcare workers moving out, even from public to the private sector, and from the country to another country. Yes, definitely. But it's not COVID related, so I will not answer that.
okay, next question. Is there a sustainability plan for psychosocial support for healthcare worker in Malaysia?
That's a very interesting question. I think Natasha asked this question.
Yes.
Yeah, for psychosocial support. Right now, as you see, mental distress and so forth is in the rise. It's not only affecting the healthcare workers, but also patients and also the family and the communities because of the lockdowns, staying at home and so forth. So I think we really need a sustainable plan to sustain this, to maintain this, and we have to find other ways in handling our mental psychosocial support, perhaps by using tools and then digital tools and so forth. So we already started to look into that and see how we can further help our people and also our healthcare workers in this. And definitely we also have shortages of clinical psychologists and counselors. So I think NGOs also will play a big role in managing psychosocial support.
Okay, I think this question, this answer might be same, but I just shoot the question first. Is there any motivation activity for healthcare worker at the time of COVID-19 crisis?
Well, I wouldn't know how to answer that, but I think the facilities, the hospitals or the clinic or the health district office, I'm sure they will have motivation activity to keep them, to keep them distressed and so forth. I'm not sure of this, what's happening on the ground in that sense.
Okay, the last question, the one that from the chat box. How the public health workers who do the tracing and tracking for the COVID exposure? Patient under investigation?
How the part who do the tracing? I'm not sure what Boon Chai means by this question, but I think he's asking what about the healthcare workers who are working in the ground. Yeah, all follow the same SOPs, whether they are working in the ground not in the hospital but on the field. I think they also follow the same SOPs in terms of distancing, in terms of PPE and so forth, and declaration, and also screening before they start their work. It's the same.
Thank you, Dr. Fazila. Okay, there's no further question from the attendees. Maybe we can open to Dr. Boon Chai and Dr. Elvin.
But before that, I think Azli Hanis, which I've introduced earlier, has also given some answer here. There is a national task force that is done for the vaccine, And there'll be 3 phases, where the first phase will be for our frontliners, followed by the patient with comorbidity. So you're right, the frontliners will be given a priority. I think frontliners is not only healthcare workers, it's also the other, the other agencies who are also the frontliners.
Yes, can you hear me?
Yeah,
Yes, Dr. Bunchai.
Yeah. My question, my last question is about I think one of the challenge for many countries is that the people who will do the kind of the surveillance tracking and tracing
on the
field, and then that is one of the challenge is that how we can find enough healthcare workers to do that, including like your SOP that you said in the very early phase in COVID. In Thailand, we have this challenge. How we gonna? We have no enough PPE and protection for that maybe in the field who are do tracing, not the healthcare.
Yes.
You talking more about healthcare, but the public health people who will do going to the ground, to the village or something like that.
Yeah.
One thing I would like to mention is that with the psychosocial, I think in Thailand we also have not just because of the COVID, but because of the economics. A lot of suicides are increasing. I think this kind of the challenge it would be in several countries also,
Yes.
but that's why the balancing between open up the countries and protecting the country is one of the big issue in Thailand now. And right now we are starting to have a more infected, which is mostly come illegally moved from Myanmar to Thailand, because we have a very long border and there are a lot of infected case in Myanmar. That is one of our scaring now, that we are going to have the second phase or the second phase. So Alvin, could you give the last word? I just comment. Comment to contribute to this webinar. But I really impressed of the Malaysian to have so many SOP and also a very structure of what you are doing things. I don't have Thailand also, so we have a kind of the guideline and manual, but what I'm to the top of my head, they don't, because they are very complacent that they don't have much case, that why they don't update the situation.
Yeah.
Over.
Yeah, I think Bunchai, just a comment to that. I think complacency is very, very dangerous, isn't it? I think we also had a period of complacency, and I think we must. That is very actually very dangerous. And you are right. It's a delicate balancing act, between economic and health. And we are also facing the same challenges now. How to we need to open up. The economy is badly affected. But at the same time, we have this third wave, which is worse than our second wave. So we are trying to balance it. So we really hope that we can get over this period.
Okay, thank you, Dr. Fazila. Thank you, Dr. Bunchai. Okay, we hope that everyone has a new insight and knowledge from today's webinar. Once again, thank you to Dr. Fazila and all our reactors for sharing their expertise with AHIN committee. Before that, don't forget to join our 7th AHIN General Meeting in January 2021. For more information, please visit AHIN website. Thank you, everyone, and good night.
Yes, again, thank you, everyone. So I really hope you block your date in January for our general meeting. And for those who are new on this call, Please check out our website for the Asia eHealth Information Network and join this family. Thank you again and good night.
Okay, thank you. Good night.